So our data in this study showed that older adults with Alzheimer's disease and other related dementia often do not receive emergent interventions or ICU care directly after transfer. Those results raise the question, should we be taking more time before transfer to discuss all the options with the patient and family and build other alternative care solutions into our healthcare system for those vulnerable patients? My name is Nancy Glober. I am an assistant professor of emergency medicine for the Indiana University School of Medicine. I also serve as the medical director for the Transfer Center for Downtown and the ISR regions for Indiana University Health. When considering disparities in patient experiences during interhospital transfers and the significance of these disparities, I think about patients in rural areas that we were examining in this study, and particularly patients who are in vulnerable populations, such as older adults with Alzheimer's disease and other related dementia. Those vulnerable populations are at particular risk when they're transferred. And if they don't have a subsequent ICU stay or a subsequent intervention, I think we ought to be taking a real careful look at when we transfer those patients, when it's consistent with the patient, family, and goals of care, and what alternative care solutions we may be able to implement in order to avoid the transfer altogether. So when I consider the impact that having dementia may have on the care received during interhospital transfer, I focus on the concept that these patients are representative of a really vulnerable population. During this transfer, they can develop pressure ulcers, confusion, disorientation from being away from their typical environment and their typical routine. Interhospital transfers may offer opportunities for specialist consult or advanced care that is not offered at the initial hospital. But because these patients are so vulnerable to risk during transfer, we need to be especially thoughtful and considerate about weighing every risk and benefit in a patient-centered fashion. When I consider the next steps for this research and what could be done to improve the care for dementia patients during interhospital transfers, I'd really like to develop a trial with a care coordinator who can take the family and the patient through each step of the transfer and really take the time to discuss the risk, the benefit, and the expected outcomes for patients who are awaiting non-emergent transfers. I'd like to use that care coordinator to put the patients in touch with the specialist providers before transfer happens so that a detailed plan is in place, everybody knows what's going to happen, and we are really consistent in a very deliberate way with the goals of care of the patient and the family.